Hello, this is Dr. Hilary Glick, here to speak about trauma. In considering working with a trauma victim, one of the things that you have to consider is the recency of the trauma. And another thing that you have to keep in mind is the chronicity of the trauma, and also whether the perpetrator of the trauma is someone that the person knows and possibly loves, or a stranger. So, these are all considerations that you have to keep in mind in thinking about what kind of treatment would be appropriate, and also in terms of what kind of support system is available to the person. If there is an immediate support system available, you certainly want to mobilize them and possibly educate them as to how to best help the person who has been through this traumatic experience. What's in common, however, with anyone who's been through a traumatic experience in treating them is that you really need to establish a sense of safety. I mean, certainly in the therapeutic relationship, safety is paramount, and you can't expect that person to trust you immediately. You need to let them know that that's okay. You also need to let them know that they have some control over the work that you're doing, that they can say this is too much, that they can say stop, and that that you'll respect that. By the same token, they need to know it's safe to tell you, and that you can handle the horror and the distress of whatever the details are of what's happened to them, that you're able to listen and willing to listen and interested in whatever it is that they do have to say. And another thing that I think is very important is the issue of shame, that frequently traumatized people tend to feel at fault for what has happened to them. In some cases, it's a way of restoring a sense of control over an uncontrollable and horrific situation. And so frequently, in fact, I would say almost always, somewhere under the anger, the pain, the distress, the anxiety, all the other things that will present probably earlier on, there are issues of shame, and that if you have not gotten to that level, you really haven't finished doing your job. So that, in very short, is an overview of yes, my position on treating trauma. Thank you very much.